This, on the other hand, is a 17-year-old boy with alveolar rhabdomyosarcoma. That's a particular flavor of rhabdomyosarcoma that likes to insinuate in the marrow of the bone. So what's interesting on this one is they did a diagnostic CT and bone scan at the time of initial evaluation, and the diagnostic CT had a solitary line or a single line in the report saying there are no suspicious lytic or blastic lesions, end for the bones. Nothing aggressive, it was done. The bone scan does show you some urinary retention here. It's actually stuck in the kidney too, but when the patient catheterized himself, the bone scan was normal. So basically, there were no sites of osseous disease on the bone scan. On the FDG PET, every single bone in this 17-year-old child's body is involved with disease, every single one. This is the large mass sitting in the pelvis. On the MRI, this is a T1 weighted sequence. You know that because CSF is dark. If you look at the marrow should be fatty and it should be high signal intensity. Every single vertebral body is involved by disease. The key with this is that this was marrow disease. And because it was involving the marrow and it hadn't actually caused any osteoblastic reaction and no change in bone mineralization or in matrix, the bone scan couldn't see it because it's looking at osteoblastic activity and there wasn't any. The diagnostic CT couldn't see it because it was looking for changes in density and there wasn't any change in density. Only those modalities that showed you the marrow, which MRI can do, or looked at the malignant cells themselves, which the FDG PET could do, showed the disease in the bone. So always go back to first principles and think, what are you actually imaging? Because just because you say there's no bone disease on an imaging study that is done to look for bone disease, such as a bone scan, doesn't mean there's no bone disease. It might just be involving the bone marrow rather than the cortex.